All right, everybody, we are live on air. Good morning. I want to thank all of our participants and all of our viewers online for joining us today in the Pitt County COVID-19 media session. This is session number 18 for May 21 at 11:30 a.m. We have some opening remarks from Dr. Silvernail, and then I don't believe there are any other prepared statements. So after that, we'll go right into our question and answer session in the order of all media who called in. So we'll go ahead and get started with Dr. Silvernail.
Good morning, Pitt County. I need to go off leash briefly this morning. Today is my niece's 25th birthday, and I need to say happy birthday to her. So happy birthday, Lieutenant Samantha. First lieutenant, proudly serving at Fort Benning, Georgia. That's why I have my Army tie on today. Back to business. We continue to accumulate cases in Pitt County. We're up to 229 cases as of this morning. Data flow continues to be a challenge at all levels, both locally and at the state. And we believe we are not getting every negative result. In fact, I'm pretty sure we're not getting every negative result, which adversely affects our ratios or percentages. Walmart testing, to date, we believe that only 98 people have tested at this site. One positive result from that site was reported to us as a Pitt County resident. There were some additional positive tests there, but those were residents of other counties as best we can tell from the data that the state has provided to us. Let's take a look at the graphs. Mike, are you controlling that? I'm on? Okay. Our first graph, again, here's our daily case counts for Pitt County. We are now, I think, maybe what we say, 69 days of results. So when we look across that, we have a range of 0 to 10, a couple of 10s recently. If you average all those cases out across the 69 days, we come up with a daily case average of 3.31 cases per day. And that average has been pretty flat across that time span. Second page is our cumulative case curve. And again, I want to remind you that we will, since we don't take cases off of this curve will always continue to grow. We have seen some more growth this week. It looked like it had started to shoulder off, but we've gone up a little bit. As we look across the region, not necessarily in Pitt County, but across the region, there is some increased activity across the region, and maybe a little bit of increased activity in Pitt County. But we are also testing more people throughout our medical system. So as you test more people, you will find more cases. Next graph, this is our percentage of positive tests as a total tests. We had come down beginning about April 16th. We had started to fall on this graph. We bottomed out at 7%. We've crept up a little bit this week, but again, that percentage is probably creeping up a little bit this week because we know we're not getting all the negative tests. So when you don't put numbers into the denominator and you do put numbers into the numerator, you will see the percentage creep up a little bit. So we've crept up from 7 to this morning. We were at 8% in our testing returns as of this morning. And lastly, this morning, this is our summary chart that gives us our totals. That we know of 2,875 individuals who've been tested in Pitt County. Of those individuals, 2,646 have reported negative. 229 have reported as positive cases. As of Wednesday, actually today's Thursday. As of Wednesday, we had 147, the 18th, 147 individuals recovered. I was telling Mike that number has become a very tedious calculation. Again, all of our data processing is manual. We will probably only show that 3 times a week just because of time constraints and my limited time to sit down and actually calculate that number. We are holding steady at 2 COVID-19 related deaths in Pitt County. I'll leave that screen up, I guess, Mike. Do you have the weight wash one up at the end too, or not? All right. Want to touch on a couple of other public health issues. This is Memorial Day weekend coming. First, please remember the true meaning of Memorial Day. As you celebrate this weekend, please do so responsibly. Remember to practice social distancing and proper hand hygiene. Practice safe food handling. Be sun safe. And please don't drink and operate a motor vehicle of any kind. Again, mosquitoes. Again, mosquitoes do not spread COVID-19. But with all the rain this week, please take the time to tip and toss containers around your home, which could be holding water. Even a small container of water can become a breeding ground for mosquitoes. And mosquitoes that are container breeders like to bite us. So please empty those containers around your house. Finally, a couple of notes. Pitt County Health Department is working with the Pitt County court system to facilitate the reopening of the courthouse. Pitt County Health Department is also working with many local businesses to assist them with their COVID-related issues. I thank you for your time this morning and for your time for these 18 media sessions. And please remember to wear, here's my mask, wait, and wash. Thank you.
Dr. Silvernail, if you want to stay right there, we can go ahead right into the question and answers. We'll start with WNCT, Ariana Kraft. Do you have any questions for Dr. Silvernail?
Yes, thank you. Good morning, Dr. Silvernail. So as the governor is advising a more modified, slower approach to phase 2, do you have any advice to restaurants and businesses that are looking to reopen in the coming days?
Well, we are all subject to the governor's order, and I would advise folks to follow the governor's order. The state health department or Health and Human Services has put out guidance. They've also put out a voluntary training program for restaurants. It's called Count on Me NC to help restaurants through this transition. And I would encourage restaurants to use that material. And we look forward to when we can get even closer to normal.
Certainly. And when it comes to consumers, is there anything specific you want people to keep in mind as people start to venture out a little bit more and, try to get some sense of normalcy, but also understanding that COVID is still among us right now?
Yep, COVID is still with us and will likely be with us for some time to come. We know how to protect ourselves from this, and we need to take those steps to protect ourselves. So I encourage people to maintain their distance from others who they're not routinely around. Meaning family members that you spend time with or live with. We encourage you to continue to wash your hands, be very mindful of your hand hygiene. And we do encourage folks to wear masks when they're in public. I was talking with one of our commissioners yesterday. I said, in general, I haven't worn a mask because I didn't want people to think I was afraid of the virus, and I'm still not afraid of the virus, but I will take the steps to protect myself and to protect others in the community. So I now have a mask in my pocket, and in public, I will wear that mask when I'm in the market and places like that to help protect people from anything that I might be carrying, even though I do not believe I'm sick.
Great. And as you briefly mentioned, the health department is working with businesses to overcome any issues that they might run into with the phased reopening. Is there anything, specific in terms of that, you would like to share with about, any things that businesses should just watch out for?
Well, sooner or later, I think, every business is going to have somebody who tests positive or has been exposed to someone who tests positive. So if they have questions about an exposure, if they have questions about the tracing of contacts within their organization, please reach out to us. Our hotlines remain open, and they're available through the main health department number, which is 252-902-2300, 2300. And we're happy to assist them with specific questions. Sometimes it's hard to give general guidance, Ariana. Everybody's physical layout and physical needs in a business or manufacturing plant is different. So we're happy to work with those people, work with those employers to protect the safety of their workers, as well as the safety of any customers or consumers that might enter their business.
Great. Thank you so much for your time.
You're welcome.
Next up from the Daily Reflector, we have Elizabeth Johnson. Do you have any questions for Dr. Silvernail?
Yes, I do. Good morning, Dr. Silvernail. So you said that, the positive, the amount of tests returning positive is 8% now, that we're not getting all the negative results back. But, with this reopening, do you expect to see an increase in the positive, the amount of tests returning positive, the percentage, I mean?
Area, I suppose as we allow people to intermix more, there's always the potential for some transmission. Again, the good news is we do know how to protect ourselves from this. If we maintain that social distancing or physical distancing with people, if we sanitize our hands frequently, wash our hands frequently, and if we mask ourselves so that we don't spread the virus between one another, and probably it's direct human contact, it's that direct person-to-person spread from coughs and sneezes and other ways that respiratory secretions get exchanged. That's really the most important thing in the transmission of this virus. So if we can interrupt that, we should be able to reopen without a significant increase in the number of cases. Is there risk in reopening? Sure, there's risk in everything we do, but I think Americans are the kind of people who accept some degree of risk. And again, this is a risk that is manageable because we do know how to protect ourselves from it.
And, kind of with this risk, at this time, do you have any numbers that, you're kind of preparing for of how many, the amount of tests you're kind of thinking the percentage will return positive? Do you think at this time there will be the test increasing? Sorry if I worded that terribly wrong.
Well, we are, as part of the reopening strategy, the state has encouraged us, our local leaders have encouraged us to open up more testing. We're in discussions as to how we might best conduct that operation. One option is to put a number of fixed testing sites out there. I think in reality, we will probably open a couple of fixed sites in high population areas, and then do some roving testing with a more mobile or intermittent testing in some of the more rural or peripheral areas of the county, so that we hit those areas as well. We will be releasing that plan probably sometime next week.
Okay. And if we begin to see 20% of cases returning or of tests returning positive, kind of what will happen?
I'm not sure that I would think that is a very unlikely scenario, but in the event that there was a large increase in cases, the opportunity or the option to restrict some activities would be on the table. If those were traced to a specific activity, limits on that activity could be placed. I think it would depend on what we thought the root of that exposure was. We know people have been moving around already. We know some of our larger retail establishments have been open and have had many folks in them. So there's already been some intermixing of our population without a big increase, and I'm hopeful that will continue.
Okay. And earlier you said that on a few days the case count had jumped by 10, correct?
We had 10 positive cases return on some days, yes.
So on May 5th, the cases had jumped by 9. So is that still an outlier? Are these 10 days where 10 cases had returned, are those outliers also?
Well, again, there's more testing being done, so we're likely to get more positives. When we average that out across the time span that we've been doing it, our average remains at 3 and change. So from an average standpoint, it doesn't appear that there's been a big trend upward in the number of positive cases that are returning.
Okay. And with this increase in testing, are we able to see a more accurate picture of how many people actually have coronavirus and how it is impacting, the community and population?
The testing that we will be doing is active surveillance. So we're looking for active cases. So right now, if we're running 7 or 8% positive, that means 7 or 8 out of every 100 people tested have COVID-19. Most of the folks being tested are symptomatic or have had contact with cases. When we get to an asymptomatic testing, that percentage is far lower. Well, I'm aware of a couple of operations not done by Pitt County Health Department where in excess of 100 individuals were tested at both operations and no one returned positive in an asymptomatic pool of patients.
Okay. And sorry, back to the 10 case increase in one day. So are you seeing an increase? Is there an increase in people with coronavirus, and kind of what does that mean, if there is?
Well, the other thing is that you have to remember there's a recovered number. So at any given time in Pitt County, we're running approximately 60 active cases of 60 people that we think have active virus in their system. So again, these are cumulative numbers. When you look at the cumulative curve, we haven't really shown an active case number, but that active case number has been between 50 and 60. I haven't done the calculation since Monday. I know there are a number of additional individuals that we will consider to be recovered when I run that number tomorrow. So again, we're probably somewhere in the 60 range of active cases. That's a little bit up from where we had been, but again, we have, in terms of total numbers being tested, more total numbers. So.
Okay. And Vidant reported an uptick in hospitalizations this week. So can you explain kind of what this means when we have more patients hospitalized?
I don't speak for Vidant Health. They did have a weekend increase in cases that has been trending down. But again, I don't speak for Vidant Health.
Okay, thank you for your time.
You're welcome.
Next up, we have WITN, Clayton Bauman. Do you have any questions for Dr. Silvernail?
Yes, Dr. Silvernail, and forgive me if you have answered this. I've been working on some other stuff too while you guys have been talking. But you mentioned that 98 people have come out to the testing site at Walmart. Would you encourage, folks out there, more people to take advantage of that testing site? And what should they be looking for in their own symptoms to warrant going to one of these testing sites?
Mm-hmm. Yeah, the Walmart site has been, the hours are relatively short still, Clayton. They're 7 to 9 in the morning, which is inconvenient for some people. And when people have tried to register, they've been blocked out because spaces are filled up, but they've also had a fairly high no-show rate. So I would first encourage people, if you do make an appointment, please go get your test done. There's no cost to you, and so please go get your test done. If they see a need, meaning the demand for testing is higher, they may increase their hours. We don't really control that operation, but if there is the opportunity potentially for them to increase testing available at that site, we think that that's a reasonably convenient site for many people. No site is ever perfectly convenient for everybody, but we do feel that that's a fairly well-located site that could serve a number of people. We know it's also not only serving Pitt County residents, there are other county residents who come and shop at that facility and who have been tested at that facility.
All right, thank you. And the governor's order, of course, will soon allow people to eat inside of restaurants in a limited capacity. Do you, as health director, do you feel safe enough that you yourself would eat inside of a restaurant right now?
Yeah.
Very good. Okay, thank you. That's all for my questions.
You're welcome.
Next up, WCTI, Tyler Harden. Do you have any questions for Dr. Silvernail?
Yes, good morning, Dr. Silvernail. First, I have to say happy birthday to your niece as well. Could not, get in there without saying that. But as far as my questions, I was going to say, ask you, are health inspectors checking in with restaurants before reopening, allowing people to dine indoors to make sure they're abiding by the guidelines? And who's enforcing those guidelines here for the restaurants in Pitt County?
Well, our sanitarians do inspect the restaurants on a schedule. The state modified that schedule with the closures. There is not a requirement right now that we re-inspect every restaurant before they reopen. We will get them back on schedule and re-inspect them. This is part of the governor's emergency order, so the enforcement of the governor's provisions, I believe, would still fall to local law enforcement. Although if our sanitarians saw practices that were not in line with the governor's order, they could certainly report that to local law enforcement.
Gotcha. And obviously there's a little confusion with the order as far as for restaurants and bars, and a lot of places I know that serve food, also have kind of a bar atmosphere. Is there any kind of clarity you could give towards business owners about kind of how they identify themselves if they're a restaurant versus a bar?
Boy, I think that goes back to how they're licensed, Tyler. Restaurants frequently do have bar areas. Bars frequently serve food, but I think that goes back to how they're licensed or registered with the state.
Got it. All right. Well, that is all of my questions for today. Thank you, Dr. Silvernail.
Okay, Tyler, I would mention our age range. I can't believe that you didn't ask me that this morning. And I looked it up specially just for you.
Well, thank you so much. I do appreciate that.
Our youngest case is still at 2. We have had one person who is 94 who tested positive. So our age range on cases is now 2 to 94.
Quite a change. Thank you, Dr. Silvernail. I'll update that for later tonight.
Okay, I don't know that we can expand that too much more, Tyler.
Definitely, I agree.
You're welcome. Good.
Thank you, Dr. Silvernail. Before we jump into any questions and answers for any of our other municipalities or participating partners that are on the line, I do want to make a note. We do have one quick special announcement that I will hold till the end of this media session. But let's go ahead to the questions for any other participating partners. I do want to say that we'll go down the list of who they are. In attendance here, we have the county manager, Scott Elliott. We also have the emergency management director, Randy Gentry. And on our virtually, we have Pitt Community College, Greenville Utilities, they may be off the call now though, and Pitt County Schools as well. Let's see. Oh, we did have a Pitt County commissioner. She may have had questions. Commissioner Mary Perkins Williams, did you have any questions before you go into that?
No, I do not have any questions. I had to unmute. But
Okay.
if I did, I would ask Pitt County Schools, are they working on a plan for reopening?
Jennifer Johnson, are you able to answer that? Jennifer Johnson, Pitt County Schools, are you still on the call? Did you hear that question?
From what I'm looking at, she should be there.
Can you
Okay.
hear me now?
Yes, we can hear you now.
Oh, great. Yes, Pitt County Schools is certainly working on looking at the opening of the school year next year. We are receiving guidance from the CDC on school openings, and you can find that guidance on the CDC website on the recommendations for school openings if anyone is interested in that. So of course, we are looking at that. And then of course, that means we have to really plan our logistics here at the school level and the county level for what that actually looks like here in our county. But yes, we are certainly working on that and monitoring that, and certainly consulting all of the experts on that.
So a complete plan you've not completed your plan, but you're working on it. And when you get it completed, it will show up on the what website?
Yes, ma'am. So we do not have a complete reopening plan at this point. We've only received the CDC guidelines for reopening a school like just a few days ago. And so we are working on that. And that takes quite a long time just to look at the logistics. But we do understand that we are in a time crunch. August 17th is less than 2 months away. And so we really need to look at and see what that looks like. We're working as hard and as quickly as we can. But yes, we will communicate that to all of our stakeholders as soon as we possibly can. We'll put that on our website, or we'll put that on our social media and send out phone calls as well.
Thank you very much.
Okay, moving on to all of our media partners that are on the line. We'll go through those in order real quickly to see if there are any other questions for any of our other partnering agencies. Ariana Kraft, WNCT, do you have any questions for any of the other partner agencies with us on the call today?
Yes, I have a quick question for Jennifer Johnson as well. Just in terms of graduation, I know it was released some graduation plans, but with Governor Roy Cooper's maximum of 25 people outside, does that impact any plans that were in place?
We are still working on that.
Jennifer, you may want to repeat your answer. We didn't hear the first part of that.
Absolutely. So just wanted to make a correction that August 17th is 3 months away, not 2 months away. And so we have a little bit of time on the opening of school. But Ms. Kraft, for graduation, we certainly just received that order yesterday, and we are looking at that order, going through all of the orders, all of the exceptions, or all of the exemptions to some of those, looking at our plan and making sure that we are consulting with local officials as we've been asked to do on that order and on the previous order for schools and graduations. And so as we work through that, again, that was just announced at 5 o'clock last night, we will certainly just see if there are any adjustments that are needed.
Thank you.
Okay, thank you. Next up, Elizabeth Johnson, Daily Reflector. Did you have any questions for any of the other participating partners on the call?
No, thank you.
Okay. Clayton Bauman, WITN, did you have any questions for any of our other participating partners? Clayton Bauman, WITN, did you have any other follow-up questions for any other partners?
I do not. Thank you.
All right. And WCTI, Tyler Hardin, did you have any questions for any of the other participating partners? Tyler, WCTI, any other follow-up questions? Okay, I will take that as a note. Just want to give one last quick announcement. This now makes the 18th COVID-19 media sessions that we have held since we began these on March the 17th. And since we started our response publicly with the posting of the coronavirus information page on our website back on March 4th, this now makes the 20th public media session that we have held with the media, including the 18 media sessions and a joint press conference and prior media session to that. With that said, as we move into phase 2 of the governor's transition plan, this will be the last publicly broadcast media session that we will host beginning next week on Wednesday, May 27th. We will instead transition to offering a weekly in-person media availability opportunity to all media and any community partners to join in on that. That will be in person, most likely at the Public Health Department or somewhere in a close proximity to the Public Health Department. And further details will go out to the media on that later today. They will not be streamed live. And as of starting, initially, there will not be a Zoom or teleconference availability for that. It will be an in-person media availability only. And it will be on Wednesdays once per week. They will be recorded and they will be posted on the Public Health Facebook page immediately following those availability opportunities. And they will also be available on the coronavirus information page of the Pitt County website. Regardless of the de-escalation of our COVID-19 media sessions, real-time updates will be maintained on both the English and Spanish versions of the coronavirus information page of the Pitt County website. Additionally, relevant information will still be provided to the media as needed through press releases and public notices from the Public Information Office. All three of the public outlets for receiving COVID-19 information will remain operational. To recap, those outlets are the Pitt County website at www.pittcountync.gov/coronavirus, the hotline at 252-902-2300, and the information request form at www.pittcountync.gov/COVID-info. Again, this information will all be sent out to the media later today with further details, and it will be posted online on our website and social media outlets. In the meantime, please remember these three options are available to anyone who needs information in regards to Pitt County's response to COVID-19. And thank you all for watching.